Morning, everybody. Thumbs up if you can hear me. Hopefully, you all had a dry weekend. At least Saturday was nice. Malia, how was your weekend?
Hi, good morning. Nice to see you all and have a voice back compared to last month. My weekend was good. I was in Sacramento for the CHCF fellowship last week, and on my way back over, stopped in Willow Creek for a night, and then was driving over the pass yesterday and got hit by pieces of the storm. And then as we climbed over the summit, it had a moment of peaceful, snowfall, which was lovely, and then back to storm and windiness as we got to the coast. It was a nice reminder to pause amidst the chaos and appreciate some moments of peace. And I just wanted to, I know there was a question last month of when can we stop saying Happy New Year? It's coming up soon. The Lunar New Year is coming this weekend, and there's some wonderful celebrations of welcoming the Year of the Dragon. So be on the lookout for some announcements around things going on in Eureka, I think on Saturday. And then there's a Betty Chin book signing as well on February 10th that I can send out information about as well for her new book called The Gray Bird Sings, which is a wonderful opportunity to meet her and learn about her work. So Happy New Year.
Thanks, Malia. I'm glad you made it back safely. So today I wanted to talk briefly about some clinical updates and then letting you know about some organizational updates as well that are coming. And so I'm going to share screen. Can you all see that? Great. So keep in mind, this is our new intranet. I had talked to IT too, because usually when we whenever we open up a web browser, we just put in web portal. It would take us to our old web portal, but they took that away, and so now it's just going directly to Opendoor SharePoint, which is our intranet. And that's our home page when you click on it. So just keep that in mind. If you have continued issues where people don't know the link to our intranet, let IT know so they can make sure all the browser that when you open a browser that it will take us to our intranet or our Opendoor hub is what they are calling it. So letting folks know whenever you can, click on the clinical and operation resources, and it will take you to all the clinical guidelines that we've been updating. And so I want to bring your attention to two things. The first one is the Doxy-PEP algorithm that we just came out with, and then the HIV NPEP. And if you click on that, it will lead you to actually our SharePoint that is also live. So whenever I make changes now, it go directly live. You don't see that. You only see the view one. But whenever we make changes, it's going to be very, very like immediate. Or if you prefer to look at the PDF version. So just letting folks know, this is Doxy-PEP, okay? This is very, very different from other things. And this is to prevent syphilis, gonorrhea, and chlamydia. As we know, in Humboldt County, the rates of syphilis and other STIs have gone up drastically. And so it's important that if patients are qualifying for this, that we give them the Doxy-PEP treatment options. And so remember, it's the prevention of syphilis, gonorrhea, and chlamydia. And so if you ask them if they've had condomless sex less than 72 hours, it goes to one route. And if not, it goes to the other route. But ultimately, if they qualify for it, then we give them doxycycline, which is a 200 milligram dose once. This is to prevent, once again, syphilis, gonorrhea, and chlamydia. And make sure that we use the appropriate time to do preventive sexual health counseling and education. The other thing that's big is, we serve a large population of HIV patients. And so the other algorithm we want to let folks know about is the HIV NPEP, okay? And what that is basically non-occupational. So it doesn't apply to us if we are exposed to that. We're talking about like non-occupational post-exposure. This is to prevent people decreasing their risk of getting infected with HIV. And so that's the PowerPoint version or the PDF version. Once again, making sure, have they been exposed less than 72 hours? And it goes to different sections depending on what their exposure is. And also let you know, this is so important right here on this page, is the estimated per act risk of getting HIV by exposure. And so this can break down a lot of misconceptions of how people can get contract HIV, biting, spitting, throwing bodily fluids, or sharing sex toys. The risk, and this is risk of per act, is negligible. And then bloodborne, which is very minimal now, since we always test whenever we screen them whenever somebody wants to donate blood, versus sexual act. Here it will tell you what is somebody's likelihood of getting HIV. But regardless, that once they're exposed to it, there are very good medications now to decreases their likelihood after they've been exposed to HIV, depending on the source, whether it's if we know the source or not know the source. And so those are the two algorithms that we just updated. It's on our clinical resources page, along with other things such as asthma, hypertension, diabetes, and so forth, and other STI stuff as well. The other thing I want to let you know about is COVID, my least favorite topic to discuss. And so once again, you can go to under the clinical resources as COVID. The CDPH finally has updated their guidance on when somebody is tested positive for COVID, when they can go back to work or school. And so we just updated. We knew this from the beginning, but they finally decided to update it based on the science. So when somebody tested positive for COVID, there is no longer a strict isolation period of 5 days. Those 5 days gone, okay? Because COVID, we should treat it like other respiratory infections. We don't do the same thing for flu. We don't do the same thing for RSV. So why are we treating COVID differently? So if a person tested positive for COVID and they have no fever for at least 24 hours without using fever-reducing medication, and they're getting better, they can return to work without any specific isolation period. We just ask that they wear a mask through day 10 of their illness. And of course, if they're not feeling better, they should stay home until they feel better. So goodbye to the 5-day isolation period, because there's nothing different from other respiratory infections such as flu and RSV. So just keep that in mind. That is the updated one, and you can find that on our intranet. Okay, now let's talk about some organizational update. First one is the Arcata Community Health Center, the one that we've been waiting for a while. Unfortunately, the opening is getting delayed. We were supposed to move in on January 8th, then it got postponed to January 22nd, and now it's TBD. This is all depending on the state granting our licensure. So it's going to be delayed. So we're letting our patients at HODC and NCC know and not to show up to the new clinic until further notice. The other thing is compensation. Last time when we had our listening session over the summer, it wasn't looking good financially, so we weren't sure. And Tori's message was that we were going to look at increases when we actually our finances were looking better. And so it did look better at the end of 2023. The other thing to let in mind is there was a state law that was passed that they were going to increase the minimum wage for all health workers to $21, and that was supposed to take place this summer. Well, look, right now the state is in a huge deficit. The state of California, that is, huge deficit. So because they can't afford anything, Governor Newsom is planning to defer that state law to a later time. However, at Open Door, we know how hard it is to recruit, retain our staff, and we are living in a very unique area here. And so Open Door is committed to following through with that, and not only meeting the minimum of the state law, we went above that. And so HR sent out, Michelle Clancy sent out the notice last week that we're going to move the Open Door, our own Open Door minimum wage, to $22. And that was supposed to be effective January 25th pay period. And so that is the managers, you supervisors, you probably have received an email from Michelle over the weekend on the breakdown of each of your direct reports on what their current rate is, what it will look like, and we will take the higher one for that. So that's minimum wage is going to be 22 for all of our healthcare workers within Open Door. The other thing too is we know that our MA plays a crucial part of our care team. And so we're also moving all of our MAs to $25 minimum. And so looking at this, making sure you evaluate it and having that one-on-one conversation with our staff regarding the changes. So this is our staff, non-provider, 22 for everyone, 25 for our staff. And because of this commitment, and by the way, and that's also for not only MAs, but also for our RDAs as well, the $25. Thank you, Sarah Ross, for reminding me that. Because of this commitment, we are anticipating that we're going to be looking at an $8 million hole for this year. But it is important that we commit to our people. And when we're doing this, just because we're saying, hey, everybody, we're going to be hiring MAs for $25, you're not going to notice, I'm not going to notice the impact immediately, right? Because for people who left us due to financial situation, it's going to take them a while to give that 2 weeks notice to where they're at to come back to us. For people who want to enter the healthcare industry, which is what we're looking for, they're going to have to do the training. This is an investment. It's like a seed that's going to take a while for the tree to grow and for us to know this. But it is important that we take care of ourselves and our people, the people who are doing the job. And so this is going to look like an $8 million deficit. So what can we do to offset some of that? And one of the ways is going to be to increase our access. We've been talking about for our medical people to do 2.25 patients per visit. Our goal for 2024 is actually going to be 2.5 patients per visit. So from a lot of sites, especially at Fortuna, they've been doing very well. They actually, on average, are exceeding, they're looking at 2.3 patients per hour. And so we're going to actually increase our goal to even higher to offset the investment that we've made into our staff. So just keep that in mind. I'm having one-on-one conversations with all of our medical people for the next 2 weeks and letting them know the background information and why we're doing what we're doing. Speaking of that, I'm meeting with each of our medical providers. Started on Thursday. I'm meeting for them for the next 2 weeks to let them know about our goals, where we're at. And the other thing to keep in mind too is besides the patients per hour, we've noticed that that number varies depending on where you're at. And so we're actually going to go to something a little bit more simple, which is the total visits. And so we're going to have a goal for each of our medical providers at the end of the year for total visits. And this way we can track it easier because patient per hour can be variable based on the day versus total visits. You know what your goal is at the end of the year. And depending on if this month I'm on vacation a lot, then I know what I need to do the next months to make that up. Carter is meeting with the dental folks to let them know about their changes. And then Heather is also going to meet with her BH staff to meet to do the changes as well. Keep in mind, we are also committed to giving increases to our provider staff, but we wanted to take care of our staff, our non-provider staff first. And so for our staff, the increases, the changes go into effect January 25th. For all of our providers, medical, dental, and BH, is not going to be effective until 4 weeks later, which is February 18th, since I wanted to make sure that I complete having one-on-one conversations with all of our medical providers. Carter does the same for dental, and Heather does the same for BH. I've also been talking to our site medical directors at our previous meetings. I'm going to be joining the ASA meeting this Wednesday to let folks know about what we're doing as well. The last thing is I wanted to let folks know is data. We want to make sure that we're able to make decisions based on immediate, accurate data. So I'm going to put this in the chat. It's also in the email that I sent to you all yesterday. So I'm going to share with you. This is our new and improved BI dashboard that is available for everybody to be able to see. So I'm just going to give you all a quick test of what to look for. And I'm doing this as well when I meet with each of our medical people. So when you come on to the website, this is public meaning open door. If you have a Windows login, you have access to this, okay? You have access to this. And so when you come in there, it is broken out into 3 tabs right now. Patients per hour, total encounters or total visits, and close encounters. Close encounters basically how people are doing in terms of their chart closure. We didn't think open encounters was a good term. It's too negative. Instead, close encounters focus on the percentage of people doing it. And on the right-hand column right here gives you a chance to filter it. So you can filter to any date you want based on this. When you come in there, it automatically is the default. It gives you the preceding 13 months. So this way you can see how folks are doing. It breaks it down to the type. So I can change it to, right now it just has medical, but I can change to dental, dentist, dental hygienist. If I want, I can change it to BH as well. But this gives you an overview of the medical people. It breaks it down to sites. So this is Del Norte, how people are doing per month. Eureka, Ferndale, blah, blah, blah. So you can do that. And the green is when the individual person hit the 2.25 goal. And this was last year's goal. We're going to increase that goal to 2.5 for this year. And it also gives you a trend. Why this is important is that it gives you a trend on how people are doing, because we want to see what's working, what's not working, and how we can better support each other. For 2024, besides patients per hour, we're going to be focusing on total visits. And so if you look at the total visit, overall, how did we do compared to last year as an organization, per site, and then the individual? So this way, we will have a goal for each of our medical providers to do what we're supposed to do for the next 12 months. And then this gives you a better idea of, like, for example, if provider A here, you don't know who this person is, a goal is to do, like 2,500 visits. And they're toward the end of the goal, they're like, oh, I'm pretty close to it, versus those who are falling behind. Then they can see how they can improve their numbers. So this is immediate, easily available, and it's live. And then you can change the filter. So people who want to focus on certain people, they can click on that person, and it actually will give you that number right there. So this is for site leadership team, for you to monitor. And then for providers who are doing well or struggling or whatnot, they can easily monitor themselves any time of the day. Once again, patients per hour, total visits, and then the close encounters as well. And a reminder, okay, it's already going to be defaulted to medical. And so if you want to see other people, you can actually unfilter or filter that. And then you can actually click on the selected individual as well. So that is our BI dashboard that I want people to start monitoring it on a consistent basis, because we're all about dashboard. This is a personal report card that you can see how you're doing, and it is accessible to everybody. But site leadership team, specifically you all, the site medical director and the ASD, I want you all to be monitoring this on a consistent basis to see how your providers are doing. So I'm going to pause right there in case people have questions or feedback.
I want to give you all a little context. So last year, we actually did 18,000 visits more than we had done in 2022, which means then our community had increased access, which is a big deal. And I hear from folks all the time about how important it is and what an impact it is for them to finally be able to get in to see a doctor or a provider. So this is really about us taking care of our community. We know that we have unlimited demand for our services, and we want to be able to meet that. And as you all know, the state did not provide us with any additional funding to be able to meet the minimum wage requirements. So it's up to us to be able to take care of ourselves and to take care of our community. And so all the investments that we've made over the last 3 years on building our teams and building our strength, along with the increase, really targeted around our care teams and our providers to be able to help us do that. And the behavioral health folks have done a really great job of increasing the behavioral health services that we're providing too. So there's a whole lots of opportunity for us to, serve our community better by increasing access. And our quality this year was the best that we've done ever. So I want to thank everybody for that. We want to continue to focus in on doing quality. So we'd love to hear your questions and feedback. We want to make sure you have the tools and the resources that you need to be able to be successful in serving our community.
The other thing to let folks know as well is, so last summer we did the listening sessions, and so we wanted to follow up with folks. And so at the end of this ASD, Shaylee has been reaching out to you, so we're going back to do a specific site town hall. And so Tori, myself, and the Sarahs will be going, and then of course the exec team members for their specific department. We will be able to go to your sites individually at the end of this month up, and so we're going to be doing it through end of February throughout March, and then the first week of April. So in those 6 weeks, we're going to be visiting all 16 sites to update you on what's happening with Open Doors since the last time we met, and also share with you our goals for 2024. And so yes, so keep that in mind to look out for the calendar as Shaylee is trying to navigate that. And then, so we had some chat in the thing. So one of the chat thing, we need to have full MA staff to be able to see 10 patients per clinic. That has to include enough flow MAs. Yes. And then keep in mind, and you can also utilize your RNs for flip visits to get the 10 patient. Yes. So keep in mind, this is all about workforce. And that is one of the reasons why it is so hard to retain people to compete. And then also to get people to actually enter healthcare. And so the biggest thing is going to be financially, right? We have to be able to pay them a decent wage for them to do it. And the only way to do it is you got to invest, and we have to invest now in order to actually get people to join us in order for us to do the work. And so, yes, this is all, it's like the chicken, the egg, what goes first, and they're all related to each other. And the other thing to keep in mind too is we've been trying to implement a lot of things. I want to let folks know when I'm speaking with our medical providers is that given the fact that we've always been short-staffed, it's hard for us to get our patients in, that we've been doing a lot of things that are not reimbursable that we should. And so I want to make sure that we are maximizing the things that we're doing for our patients, especially the one-click, especially with the RM flip visits, and then making sure that our support team is doing everything they can up to their licensure. So this way, the MAs are practicing to the highest level, RNs, LVNs, highest to their level, and then our providers practicing to their highest level. So this way, it doesn't feel like people are doing things that are not within their scope of practice. So all great points right there. And this is, keep in mind, goals are meant to be ambitious, are meant to be difficult and challenging, and at the same time making sure that we're able to take care of our people. And so that's why I'm going to have one-on-one conversation with each of our medical providers regarding this. Okay, with that in mind, let me recap on our meeting. First, clinical updates, making sure we check on the your intranet or the Open Door Hub. It should be the default on your web browser. If you're not doing that, please send IT a message so they can make sure, because the web portal, that website is gone. And so if people don't know how to access our intranet, make sure you contact IT so they can make it as the default on your browser. Check out our new clinical algorithms, DoxyPEP, HIV NPEP, people qualified, make sure you're treating them for it. And then the positive COVID algorithm, isolation period, no mask, no more of that. Treat it like any other respiratory infections. Arcata Clinic, crossing fingers. Hopefully the state will pull through and let us open whenever they will process our application. Compensation model, it started on January 21st, effective for all of our staff. At least $22 was what I must have said 21. The state required $21. We are doing $22. And then of course for our MAs and our RDAs is $25. And then make sure the managers, supervisors review the list and having conversation with your staff if they have concerns. Our providers, dental, medical, and DH, I'm having conversation with them, and then Carter and Heather will have specifically for their department. And then I'll join the ASD meeting this Wednesday to share with folks what I've been discussing with our medical providers. The BI dashboard, easily accessible. Use your Windows login, play with it, because now we have it available, and make sure our staff and our providers know so they can track themselves. And then start at the end of this month through first week of April, Tori, myself, and the Sarahs and executive members will be meeting with each of the site for the town hall to update you on what's happening with Open Door. And then our next meeting will be on March 4th. And with that, happy Lunar New Year. It's the year of the dragon. So hopefully we will act like dragons and do well this year. Okay, everybody, have a good week.